This is Rob Leffler with PCA Pharmacy. I'm the Vice President of Clinical Services. We're going to talk about the CMS 5-star rating system, and specifically the staffing domain of the 5-star rating system. This rating system actually has three components. The first is health inspections, which is based on deficiencies from annual surveys and complaint surveys. The second is staffing for RNs and total nursing staffing. And the third are quality measures, which are based on performance on 16 out of the 24 quality measures found on the Nursing Home Compare website, from MDS assessment information, and then also claims data from hospitals and ERs. Specifically going into more detail about the staffing domain, it is based on two measures. The first is the total nursing hours per resident day for RNs, LPNs, and nurse aides, and the second is RN hours per day. There definitely is a clear relationship between staffing in nursing homes and resident outcomes. In the CMS staffing study, they found clear relationships, and they even went so far to identify specific ratios that were suggested to indicate that there would be substantially higher risk of quality if those ratios were not maintained. CMS obtains data from the most recent survey through the CMS 671 staffing tool. This category is updated every 9 to 15 months, depending on when the facility's annual survey is. It does look at the skilled nursing beds. It does not include assisted living hours. It is for all RNs, LPNs, CRCAs. Full-time and part-time staff is included, as well as any agency staffing. What is not included is private duty hours that are reimbursed by any resident or by their family. The 671 data is obtained from Casper, and CMS also does use a set of criteria to exclude any facilities that have highly improbable staffing data submitted to Casper. The census is obtained from CMS 672 Block F78. It indicates the number of residents in Medicare and or Medicaid certified beds and any bed holds. That would include any bed holds that are on the day the nursing home survey begins. The hours per resident day, or HRD, is calculated as follows. It takes the total nursing hours and divides it by the census for 14 days. This is then adjusted based on expected hours based on a facility's case mix, which is based on their RUGs, or their resource utilization groups. That data is gathered from the MDS assessments. Adjusted hours for each staff type. They take the reported hours divided by the expected hours and then multiply it by the national average. The national average is the mean across all facilities for each staffing type. The expected hours are based on the redistribution of the RUG group in the quarter that's closest to the most recent annual, also known as a standard survey. That's when the staffing information is collected, and measures of what the expected hours are for each group based on CMS 1995 and 1997 staff measurement studies. The RUG distribution is from the most recent MDS assessment for current residents on the last day of the quarter. A profile is created based on consolidated data from each active resident. An active resident is defined as anyone that does not have a discharge assessment or has an MDS that's been submitted within 180 days. That's what data is used to determine a RUG for each resident. The most recent rug category distribution is done for every facility on the last business day of the last month of the quarter. What they do is they select a target date. That target date is 7 days before their most recent annual survey. They do this because Casper covers the 2 weeks prior to that survey, and 7 days is the midpoint. If they do have rug data available for that quarter, the quarter that contains that target date, that's what they use for the case mix adjustment. If rug data is not available for that quarter, then they use the quarter that's closest to the target date, either before or after. When rug data does become available later, the staffing rating is recalculated. What they do is they hold the staffing rating constant until new staffing data is collected for the facility. The calculations are performed separately for RNs and for all staff delivering care. The hours do get adjusted for both groups based on the rugs, and they do weigh those scores evenly when they determine the final score. Here's the staffing points and rating table. On the left-hand side, you can see RN ratings and hours. You would take the RN hours and convert that into stars, which is what the 1 through 5 represents down the left-hand side. You would do the same thing with the nurse staffing hours. You'd figure out the number of hours and then convert it to a number of stars. That's what the 1 through 5 across the top indicates. And then the cross point would indicate what facility, how many stars an individual facility would receive. So if they got 5 stars in RN rating, and you can see the intersection with 5 stars of nurse staffing, that would be a total of 5 stars. That's the only way for a facility to get 5 stars in staffing, is to have 5 stars for both RN and staffing. The decision points between these stars were based on data as of December of 2011. They do evaluate the division points on an annual basis. The reason that they hold these for an extended period of time as opposed to adjusting them monthly like they do with the health inspection scores is so that a facility can adjust their staffing in order to improve their star rating in the staffing domain and then potentially affect their overall star rating. As I just said, for a facility to receive 5 stars, they have to have 5 stars on both their RN and total staffing. For the staffing domain, to receive a 4-star rating, they have to receive at least a 3-star rating on either the nurse, RN, or total staffing, and a 4 or 5-star rating on the other staffing domain. Payroll-based journal was talked about a lot at the end of last year. As of July 2016, all facilities had to report PVJ hours. In the future, it's suspected that that's where the staffing hours will actually come from rather than coming from the 671 or the Casper data. The overall rating starts with the health inspection rating, which is converted into a number of stars. Then they look at the staffing rating stars and add a star if the staffing rating is 4 or 5 stars, but it also has to be greater than the health inspection rating. So if you have 4 stars on your health inspection rating and you get a 4-star on your staffing, then a star is not added because it has to be greater than. 1 star is subtracted if the staffing rating is only 1 star. The overall rating cannot be more than 5 stars or less than 1 star. The third step to computing an overall rating is to add 1 star to step 2. If the quality measure rating is 5 stars, or subtract 1 star if the quality measure rating is 1 star. The overall rating cannot be more than 5 stars or less than 1 star. A few miscellaneous points. If the health inspection rating is 1 star, the overall rating cannot be upgraded by more than 1 star based on the staffing and quality measure ratings. And if a facility has no health inspection rating because it is too new to have 2 standard or annual surveys, then no rating for any domain is displayed. If they're missing data from just one period, then the score is based on available data with the missing survey weight being distributed evenly between the 2 existing surveys. So the previous survey would be 60% and the one before that is 40%. If they only have 1 standard survey, then there's not enough data to create their 5-star rating. Here are some websites that have very valuable information about the 5-star rating system. The first from Medicare.gov on 5-star ratings. The state cut point tables for health inspection scores is found at cms.gov. And the 5-star rating system technical user's guide is very thorough in going through all the individual pieces of information about how a 5-star rating is calculated. The website is found there. If you do have any questions about the 5-star rating system or any of the domains that go into that, please don't hesitate to reach out to myself, Rob Leffler at PCApharmacy.com or Natalie Dom at PCApharmacy.com. Thank you very much.